her thoughts and perspectives on the emerging perspectives on gender issues in India. She is a senior consultant radiologist and ultrasonologist based in Northwest Delhi with numerous publications in national and international journals and 5 novels, science recognized in medical literature, a respected faculty member at various national, state and regional radiology conferences. She has received multiple accolades for her contributions, including the prestigious National Samrakshan Award for her work in fetal maternal care. Samrakshan, an initiative by the Indian Radiological and Imaging Association, focuses on fetal and maternal health, and Dr. Aneja now serves as the National Joint Coordinator for this program. A big round of applause for Dr. Kavita Aneja. We're really honored to have you here.
Thank you. Thanks, Meenakshi, for the kind words. Good afternoon, everyone. At the very outset, I really want to thank Dr. Rama Patnaik for having me here to speak on a topic which is a little technical in keeping with my profession, and I would seek your attention for this. So this is about pregnancy. We have been talking of women as Janani and creator. So in context with that, I'm going to speak on a very important concern in pregnancy, which is hypertension happening in pregnancy. So why I have chosen this topic? Hypertension in pregnancy affects 2 individuals, the mother and the baby. I hope you all know what is hypertension. It is high blood pressure. We all can relate to this, someone or the other in the family. But when it happens in pregnancy, it affects 2 lives, the mother and the baby. So actually there are 3 reasons why I have chosen this topic. Number 1, the prevalence of hypertension in pregnancy is huge in our country. So when we look at the world statistics, India contributes to 25% of the world adverse pregnancy outcome, that is bad outcomes of pregnancies, which happen because of hypertension. Now, hypertension in pregnancy happens, a bit of introduction to hypertension in pregnancy. It happens after 20 weeks, that is after half of the pregnancy is over. Pregnancy is of 40 weeks, and when it is a severe hypertension, it affects all the organs of the mother, like brain, heart, kidneys, liver, and even platelet counts. So a severe hypertension affects all the organs of the mother, and therefore it results in adverse or bad pregnancy outcomes. India contributes to 25% of the world figure as far as these bad outcomes are concerned. In fact, India is the world capital of stillbirths. So stillbirth is when the baby dies in the womb. India has highest number of stillbirths in the world. So that is the concern. And the second reason I have chosen this topic is that hypertension in pregnancy not only affects the baby and the mother during pregnancy, but it affects the mother and the baby throughout their lives. What does that mean? So during pregnancy, like I said, hypertension affects all the organs of the mother, like liver, kidneys, everything will be deranged if it is a severe hypertension. And for the baby, the growth of the baby will be less, it will be growth retarded baby. We will have to do a premature delivery for this baby, and the baby can also die in the womb. So, and what after pregnancy? So after pregnancy, this mother who has had hypertension in pregnancy, she is at lifelong risk for diabetes, hypertension, heart disease, and stroke. Stroke means paralysis. So this mother who had hypertension in pregnancy, she is at lifelong risk for these ailments, hypertension, heart disease, and diabetes. In fact, these mothers are 5 times more prone to die of heart attack. So 2 out of these 3 mothers who had hypertension in pregnancy will die of heart disease. So it is that very relevant. Now, this affects the baby after birth. How does it affect the baby? Now, these babies who are born to these mothers who had hypertension in pregnancy, these babies will have developmental delay, cerebral palsy, and later on in life they can be obese, they can have diabetes, they can have hypertension and heart disease. So if it's a girl child, the girl child will also be obese, will also be hypertensive, and when she delivers, again she will have these problems. So this generation, this cycle goes on for generations, and we need to cut it short. So we need to act. Now, like I said, the pregnancy hypertension happens after 20 weeks and it affects organs of the mother. This term is called pre-eclampsia. So I want each and every person sitting here should be familiar with this term called pre-eclampsia, which is severe hypertension in pregnancy, wherein all the organs of the mother like liver, heart, kidneys, and brain, and even the eyes, platelet counts, they are affected. This is called pre-eclampsia, and this is where all the complications come in. Now, is there a silver lining? The third reason why I have chosen this topic is we have a silver lining there. We can act. So how do we act? This hypertension in pregnancy is predictable. यानी कि हमें अंदाजा लग सकता है कि कौन सी मदर को हाइपरटेंशन होने वाला है, कौन सी मदर को प्री-एक्लेम्सिया होने वाला है इस प्रेगनेंसी में. We can predict and we can also prevent. So how can we prevent? I'll come to this. So the silver lining I said is we can predict and we can prevent. Now the symptoms that mother will have in case she is suffering from preeclampsia, she will have swelling of feet, which is also there in a normal pregnancy, but here it will be huge. She will have swellings in hands, swellings on the face, she will have breathlessness, she will have milky urine because of protein passing in the urine, and she can have some visual problems also, some spots there or some blood evacuation. So all these problems, women should be familiar that if she has hypertension, she should be watchful for all these problems. So like I said, we can act to, we can predict preeclampsia and we can prevent preeclampsia. So how do we predict? In the 3rd month of pregnancy, we can screen every pregnant woman. Then this screening is done by ultrasound. I'm a radiologist. I do it day in and day out for all females. And we can predict by doing ultrasound and color Doppler. And also we add to this the mean arterial pressure of the mother, which is blood pressure taken from both arms simultaneously. So it's a specific way of doing the blood pressure, which is called mean arterial pressure. And to this we add history and everything, and we get a risk assessment there. And this algorithm for risk assessment is not made by me or anyone else. This comes from a lot of research which has happened in United Kingdom by Fetal Medicine Foundation. So we have this algorithm in place, and we can find the risk, and all those women who are at high risk for can you have the attention please? So all these women who have a high risk for preeclampsia, they should be put on a simple measure, which is a simple tablet of Ecosprin. So Ecosprin is a 5 rupee tablet. So all those females who are at high risk for developing preeclampsia, we do this risk prediction in the 3rd month. Okay, we have 6 months left with us. And if the risk is high, we start these women on Ecosprin, 1 tablet a day. In fact, it has to be taken at night, and it has to be continued till 9 months. So what will happen with Ecosprin? Actually, okay, yeah. In preeclampsia, it's the placenta, जिसको आप नाल बोलते हैं, which is defective, which is the kitchen of the baby. So we need to improve the kitchen of the baby so that the baby gets nutrition and oxygen. So Ecosprin, like it's given to heart patients to increase the blood circulation, same way it is given in pregnancy to increase the circulation to the placenta. So बच्चे की kitchen ठीक होगी तो बच्चा, the baby will get nutrition and oxygen, and this is how we can prevent the death of the baby, low birth weight babies and premature babies. And Ecosprin also helps the health of the mother. The mother will not develop hypertension, and even if she develops, she will develop a mild hypertension, or she will develop hypertension very late in pregnancy. So हमें premature delivery नहीं करनी पड़ेगी. We can take the baby to maturity, which is about 37 weeks. So that much of benefit we have with this little measure of taking Ecosprin if the mother is at high risk. And this is what we are focusing on in Samrakshan. So I'm a radiologist, and we have our Indian Radiological and Imaging Association of India, and we have come up with this national program which is called Samrakshan, which is in fact a movement. It's a mission to reduce hypertension and preeclampsia in pregnancy in India. Current figures are 10%. So 100 में से 10 mothers को होगा ही preeclampsia. We have a mission to reduce this from 10% to 3%. And I'm a Delhi coordinator and national joint coordinator for this program. And what we are doing is we are taking this to community level. We are giving community webinars, outreach programs at a level of radiologists, gynecologists, community, and even social media. And I want each and one of you sitting here to just spread this important message by the word of mouth that hypertension in pregnancy is a serious concern. Number one. Number two, it affects 2 lives, the mother and the babies. Number 3, we have mortality. मतलब mothers मर जाती हैं, बच्चे मर जाते हैं. In fact, while I am talking to you, every 12 minutes, one mother is dying of preeclampsia somewhere in the world. WHO and partner institutions, they are doing a lot of work on this. And even in India, like we have come up with this Samrakshan program to focus on preeclampsia and hypertension in pregnancy. So each one of you should remember hypertension in pregnancy is an important concern. It happens after 20 weeks. मतलब शुरू के 4 महीना कुछ होगा ही नहीं. You will think all is good. But 20 weeks के बाद suddenly BP starts rising, and then all those derangement of organs start happening. So this is a concern and a simple measure. Otherwise, preeclampsia, it is so financial. It has financial implications on the mothers. Even the pregnancy is 13 times more expensive. Mothers की admission होगी, baby NICU में जाएगा. It is 13 times more expensive to deal with. So just recommend 1 tablet 5 rupees की Ecosprin, which can save you from all this. Thank you very much.